Estás en sintonía con WCEA-TV, tu canal hispano.
To have you. I think I'll give a really quick kind of brief introduction and then let my colleagues speak a little bit about the details, and then we'd really like to kind of take some questions and be able to answer any questions you have. So really appreciate you all coming. I think that doing an ethnic media roundtable is incredibly important. My parents are immigrants. I actually didn't speak a word of English till I was 8 myself. So it's near and dear to my heart personally. It's near and dear to this governor's heart. It's something that he thinks is incredibly important, and we really appreciate all of you taking the time to come and meet with us. Wish this room was a tad warmer, but that's what you get for being in Boston in December. So I'm going to give you a brief introduction. MA Health Connector is .org is the website that allows the people of Massachusetts to get access to subsidized health insurance. Last year, we tried to put up a website that at the end just didn't work. The governor, as a result of that, did two important things. First, we made a temporary program available that still increased the rolls of the insured in Massachusetts by almost 400,000 people. So even though we had a website issue last year, we were still able to get over 400,000 people insured in Massachusetts through a temporary Medicaid program. This year, the second thing the governor did was created a position that I sit in now, which is responsible for ensuring that this time around the website does work and the product does work for everybody across Massachusetts. And that's what we've been able to do. We went live on November 15th. And since that time have seen a website that works. It's up and available for everyone 24/7. Its response time is quick, and we have been able to actually determine through that system for health insurance almost over 180,000 people just in the first month alone. And we think that that is critically important. There is a lot more work to do still. We get feedback from people every day about ways to improve it. We are working into next year to be able to adopt a Spanish translation to the website that will be available for folks next year. We're going to upgrade our notices to be in other languages as well over the next coming year. For this open enrollment, what we're telling folks who have some limited English proficiency is to use our phone number, to use our assisters, to use HealthCare for All, to use the variety of different community events. We have enrollment events, and we've got assisters and certified counselors, all of who can help people get access. Because I think the most important thing this isn't about a website, this is about access to health insurance. And what we want people to do is come in our door and see if they're eligible for subsidized health insurance. I think that is the most important. We can help get access and pay for health insurance. And quality, affordable health care is what this is about. And we have many different ways to be able to have people and help people access that. We also have deadlines that are very important for people to pay attention to. So I'm going to turn it over to Jean a little bit, and then she can cover some of the details.
As Maydat mentioned, full open enrollment is in full swing. I would say by this point, all of the transition members, people who are either Commonwealth Care or temporary Medicaid members, they have received at least one mailing from us, including our open enrollment packets, which is mailed out in English, but it has information that tells people if this is not your language, you should log on to our website because there are alternative language versions on our website, and you can call the call center to request additional language as well. So the open enrollment package is very, very important. It includes most of the things that Mayda just mentioned, important dates, who is affected and who should pay attention, as well as frequently asked questions on many, many key topics. So as Maydat mentioned, because the language capability of our website is going to be an evolution, so for this open enrollment period, it's very important for people who need alternative language support to leverage the other types of assistance that we have in a community. We have 15 navigator organizations spread across the state. And we have something that looks like this on our website, but we'll make sure that we distribute as well. This lists all of the navigators and the languages that they specialize, so that people can look for their language and go to the right people for help. These people are trained to support applications end to end. So if you have, regardless where you are in the application process, some people just need some decision-making support, and some people almost need to start from scratch, and our navigators are trained to provide all kinds of support. Besides the navigators, we also have certified application counselors. These are provider organizations. They have their special sort of professionals that are trained to explain the context and provide support. One of the things that we do encourage people, particularly immigrants who need to sort of figure out what's going on and navigate through the complexity here, to just go seek out help from the doctors and the hospitals that they frequently visit. We have very good coverage in the provider community in terms of the sort of the context of the open enrollment period, who needs to take action, and what are the additional knowledge, sort of information that is available. So go talk to your primary care physician, go to your hospital. Help is very, very available there. We also have our call center, which is capable through language line services to support all languages. So what you need to do is to call the call center, and you need to probably get some help. If you don't speak a word of English, get someone to initiate that call for you, and all we need to do is to identify the language. For the vast majority of languages, we can connect you with the person that speaks your language within minutes. So do not hesitate to leverage the call center to get the help that you need. Lastly, as Maydat mentioned, we have enrollment events. We just completed 2 very, very successful ones in the last couple of weeks, one in Springfield and one in Boston. The good thing about these enrollment events is that we have all the type of sort of assistance co-located in one place, whether it's you need language support or you need some help if you have a complex situation with your application and you wanted to seek some help from specialized people who know how to troubleshoot. So we have all that resources there, which is very, very helpful based on our experience. We have 2 additional enrollment events scheduled and confirmed, one in Fall River and one in Worcester. Again, that information about the enrollment event is on our website, very prominently displayed. And we are obviously looking for opportunities to do additional such events as the market demand becomes obvious to us. So we are constantly looking at these opportunities. So I would say that with all of these resources available, the message that we wanted to send is people need to act now. People need to act as quickly as possible. Do not wait. We have help that is available. And then if you have questions, please pick up the phone. Please go to an assister, go to your primary care physician. We want people to take action, and so that no one will have to experience gaps in coverage. So I'm going to first turn over to Kristen, and then certainly HealthCare for All, who has been a really key partner in terms of providing all the assistance and the resources available.
Everyone that applied last year needs to act, and we'd like to ask your help in getting the word out so that people act as soon as possible. While we were incredibly proud to be able to stand up a program to provide temporary coverage for individuals last year when the website wasn't working, that temporary program will end. And as a result of that, it's really imperative that individuals who receive temporary coverage act as soon as possible. We're also very proud to note that for the first time, we have real-time eligibility determinations for the Medicaid program as a result of our new website. For the first time, individuals can shop for both Mass Health and the Connector through one front door, and they will get a determination in real time rather than having to wait a couple of days or even weeks like they did without the online functionality.
HealthCare for All is working hard to make sure that no one loses coverage in this interim period. So folks who have had temporary coverage are urged, as you've heard, to take action now so that they can figure out which programs they qualify for and sign up for that coverage as quickly and efficiently as possible. We have a deadline coming of December 23rd. We want to make sure everyone understands in whatever language is most helpful that action, if you want to have healthcare coverage on January 1st, a lot of people need to take action on the 23rd. So very in a very short order. HealthCare for All is committed to making sure that people have access to the information they need in the languages they speak. We are partnering with 11 organizations across the Commonwealth. We are going door to door. We've committed to knocking on 200,000 doors in a variety of languages, and we actually, as of this weekend, have knocked on 119,500 doors. So I hope some of your readers and viewers and listeners have seen us in their neighborhoods wearing HealthCare for All sweatshirts and helping people understand what action they need to take to maintain their healthcare coverage. We are so grateful for this partnership and for the priority that's being placed on maintaining coverage. You know, as Maydad said, we actually increased our enrollment numbers last year, even given the challenges that we had with the electronic solution. And we are committed to making sure that if it's possible, we actually grow our coverage rates once again. So to do that, it's vitally important that your constituents are able to take the action, have the information that they need, and as Jean said, there are a wide variety of resources. We have folks in the communities who speak a variety of languages, we have written materials, and there are opportunities on the website to be directed to organizations and advocates who can help people navigate their way through the enrollment application. So we're delighted you're here. The work that you're doing and helping us get the word out will also increase our success rate. So thank you very much.